Hello, my name is Jacob Ryman. I am a former Armed Forces service member and a current student at Full Sail University. And today we're going to be talking about post-traumatic stress disorder. We'll be talking about some of its effects and its scope. We'll go over some statistics, and we'll also discuss some effective treatments. My thesis is that PTSD affects millions of people, but it is understandable and treatable if the available resources are utilized. And my personal mission is to remove some of the stigma surrounding PTSD by sharing global experiences, which will be backed up by personal experiences backed up by global statistics. In 2010, I was deployed to Afghanistan as a medic. Now, while working in Craig Joint Theater Hospital, I was exposed to the raw carnage left in the wake of explosive violence on a daily basis. And as a result, I left Afghanistan with post-traumatic stress disorder. This had a profound impact on the rest of my life. PTSD is an acquired mental disorder, categorized by hyperarousal of the amygdala. Think of it as the lower functioning part of the brain responsible for the release of endorphins like adrenaline. The hyperstimulation can occur as a single traumatic event, as in the case of many civilians, or it can happen over time through repeated exposure to dangerous situations. The prefrontal cortex is responsible for the higher functions of the brain, things like decision-making, comprehension, and creativity. Different parts of the brain communicate to one another through neural pathways that can become overtaxed and fried out in a PTSD brain. Here's how it works. You're sitting in a restaurant, and a waiter drops a tray of dishes. Your ear sends a sound to your prefrontal cortex, which sends a message to your amygdala, prepping it for danger. The prefrontal cortex then determines whether or not you're in danger and sends a second message to the amygdala, in this case the all clear. However, due to degradation of the neuropathways, the message can be lost as a result. Though you may be consciously aware there's no danger, you'll experience a release of adrenaline as though you were in the middle of a firefight. Living with PTSD is a constant struggle. The vigilance is exhausting, and sleep riddled with nightmares provides little solace. Now, one of the most unsettling things that can happen to someone with PTSD is disassociation. Commonly, people refer to this as flashbacks. They can wreak havoc on a life of someone who has PTSD. There's also a multitude of social issues that plague those who suffer with PTSD. Many find it difficult to maintain relationships that once were stable, occupational stress increases, and job security is threatened. The combination of alienation and loss of gainful employment can lead to homelessness or worse. Unfortunately, the risk of suicide for PTSD sufferers is far greater than for average Americans. It can feel like you've entered a fight that you have no chance of winning. And in the aftermath of my deployment, I battled suicidality daily. It wasn't until 3 years after I returned to the States that I found myself in a VA treatment facility. The VA care staff recommended that I stay at the newly opened Valor House, which is a homeless shelter especially for veterans. The staff were friendly and helpful, and it helped me achieve a level of stability that I needed to begin treatment, which I did shortly after staying there. The first type of treatment I attempted was prolonged exposure therapy, which involves exposing oneself to whatever the source of the PTSD is, in a step-by-step controlled process, and over time the trigger loses its power. Although this treatment is evidence-based and proven to be effective, I had difficulty sticking with it, and ultimately I had to try something different. I went on to cognitive processing therapy, which changed my life, and it involves practicing mindfulness combined with reevaluating traumatic events through a lens that's designed to identify and correct problematic thinking. After months of this type of therapy, I stabilized to the point that I could live a normal life again. Now, according to PTSDUnited.org, PTSD affects 24.4 million U.S. Citizens. It develops in 1 out of 9 women, making them about twice as vulnerable as men to PTSD. And unfortunately, it hasn't always been recognized to the level that it should. At one point, it was classified as shell shock. And veterans who were diagnosed with shell shock were subjected to partial lobotomies and other ineffective treatments. They were often misdiagnosed altogether. Finally, PTSD was recognized in 1980 as an official disorder by the American Psychiatric Association. Now, over 61% of males and 51% of females experience at least one traumatic event in their lives, and that goes for civilians and military members. About 8% of men and 20% of women go on to develop PTSD. The traumatic events in the civilian world vary greatly. However, sexual assault is the most likely to result in the development of PTSD. According to the VA, over 20% of Operation Enduring Freedom and Operation Iraqi Freedom suffer from PTSD, compared to 10% from the Gulf War and 30% of Vietnam veterans. Of the 17% of female combat troops who suffer sexual assault, 75% develop PTSD as a result. A note on stigma: in the 1982 film First Blood, Sylvester Stallone plays John G. Rambo, a Vietnam veteran and drifter who's stigmatized and targeted by a small-town law enforcement. The film won Best Picture, the Oscars, and it went a long way towards changing attitudes. There's a list of available resources on the screen now for PTSD support that you can contact, whether you are a civilian or military, and they can help you out. One thing to keep in mind, if you have PTSD or if someone in your family suffers from PTSD, is that quite simply you're not alone. There are millions of people who suffer just like you do, and I'm one of them. And by standing together, we gain strength. And if you gained your PTSD as I did through service to your country, I express a great debt of gratitude. I think it's important to note that those who do the most for this country often suffer for it the most and continue suffering for the most. And it's our debt to them that should raise awareness, and we need to do everything we can to continue this fight. Thank you for listening to me today.